Hey everyone.
Yeah, we're back.
Okay, so the reason we're so hyped up is
Oh,
because
sorry.
we're going to talk about, oh, you messed the camera.
Oh,
Hey, we're
sorry.
going to talk about hemorrhoids today.
Yes, hemorrhoids.
Okay, and the reason this was brought up because there's been some recent activity in friends of mine of hemorrhoids.
They're
And
probably not watching this though.
uh,
Maybe.
probably, I don't,
Maybe.
and it doesn't really matter because this is a real issue that more people than I realize struggle with.
The hemorrhoids.
So
But I'm
first
going
of
to give you
all,
some tips to help you out.
yes, so I want to talk about what causes a hemorrhoid.
Well, let me ask you, how long do you want to go for?
Well, let's just start going then.
Yeah, we better go because we don't go
I
go
don't
too
really
long.
honestly care how long we go for, so we'll give a preface at the very beginning of this. Watch as long as you can. If you or someone that you love suffers from hemorrhoids, there's going to be some really valuable information.
Okay, so
So,
let's check this out. So, a couple of things with hemorrhoids. So, if you ever notice bright red blood and you're not on like menstrual cycle and you're noticing it from when you go number 2 or defecating, if you notice bright red blood, that could be a hemorrhoid. And the most common causes of it is actually constipation, and I see it more often in women with low thyroid. So one of the symptoms of low thyroid will be constipation. All right. So with constipation, then generally the female in the female population, not as common in male, there'll be more pushing, right? And so will cause the vessels right down in the colon, the sigmoid colon, right almost to the anus area. It'll start causing. Imagine that your blood is pooling till finally that little vessel pops, or you get a slight outpouching of the colon wall. All right. And sometimes people will say, well, it feels like a little grape down there. That's a hemorrhoid. Or if you see a little bit of blood, that probably means that a little bit of a blood vessel popped and you're seeing kind of the remains of a hemorrhoid. So what causes that? Generally from pushing. Now, the other thing that causes hemorrhoids, and they don't talk a lot about this in the research, but it is there, and I know this because it's in the clinic. You'll see it in the clinic if you're a doctor, is bacteria or parasitic infections. Microorganisms or even yeast can cause hemorrhoids. All right, so that means that you need to have a good probiotic for the colon. All right, so large intestine. The other thing that what's really interesting, if you'll turn to the side really quickly, the other thing that can contribute to a hemorrhoid, not very well known, but right at the C5 nerve root. So right here, just up from kind of the base of the base of the neck here, up 1, 2, 6, 5 right there. The C5 nerve root also, I've seen that can actually cause hemorrhoids as well. The nerves correlate from that area down into the sacral
that's
plexus,
crazy
which
to
can
me.
cause, right, which can also cause hemorrhoids. So one of the most common things that I'll check if people do have hemorrhoid is I will check for a C5 disc bulge. So not a herniated disc, but a disc bulge. Check for that. Some of the things that will really help. All right, witch hazel works very well. A sitz bath. There are some medicated type witch hazel with a bunch of other junk in it, but just straight witch hazel is the best, like a poultice. So you can get the witch hazel and then you create a poultice and you can put it right on the spot. That'll actually help, especially for women who have just had a baby. A lot of times I'll see hemorrhoids with that because of
Yep,
so much pushing.
yep.
The witch hazel will actually help suck that in and pull that in. Also another thing, so that's kind of, or doing a sitz bath with witch hazel. Or you can do like Epsom salt with witch hazel, and then like a lavender and tea tree oil is a nice combination for a sitz bath.
So a sitz bath is basically a bathtub with just a small amount of water,
Yeah,
or you
so
can
you can
get
sit
like
it.
these. They're like actually a little, almost like a bedpan,
Uh-huh.
but it sits on your toilet, and you
Right.
can sit on it, but it holds the water,
It does,
and you're
and it
just
just has
sitting.
like a little bit of water.
So a sitz bath is sitting your bum in a warm bath of water with apple cider vinegar.
Apple cider vinegar, you can use that if you suspect that it could be a bacterial infection. So sometimes a little bit off the topic, but like if a woman she's about to deliver and she comes back with a positive strep B culture, then I would recommend like apple cider vinegar. Also, though, it can be very good, yes, like an apple cider vinegar with that's great. Or doing like Epsom salt bath with tea tree oil. The witch hazel is the number one thing, and then like a lavender. Those are all beneficial. The tea tree oil will actually help kill any bacteria as well,
Yep.
which is really
Yep.
nice. Okay, so that hopefully that helps. Sitz bath. Also, you guys, butcher broom is very good, but I like even better than that Collinsonia root. It's the classic one I use is Collinsonia root. Internally, the Collinsonia root will just help suck that hemorrhoid back up. What else did it? Is there anything else that I need to tell them about?
So let's talk about besides the fact that childbirth or so constipation.
Constipation.
So constipation is the number one cause.
Absolutely, absolutely.
So and I never knew
Pushing.
that. I never knew that about the C5.
Disc bulge.
I never knew about that, but that's really good information. So this goes back to why you should eat good, clean nutrition with a lot of fiber, so that you don't have to strain when you go to the bathroom. We all poop. It's what we all do, and it's you always hear how funny. Oh, we never talk about poop, but we all talk. We all need to talk about it. So if you
you wanted this lecture? No, I'll do that another time.
Yeah, so I mean really the thing is this, if you're having trouble with constipation and you might have a hemorrhoid, these are things that we don't like to talk about, and we cover them up, and because we're embarrassed of where they are, then basically you need to really, again, for many other reasons, clean up your diet and focus on getting enough fiber.
Absolutely.
So
Absolutely.
junk food, fast food, food that's processed is going to constipate you.
The other thing, the big thing about this, you guys, is so probably the number one plug is dairy. And that'll probably plug people up the most. But the other thing is you actually need to be hydrated, really.
Yeah.
And with that hydration, depending on where your blood pressure is at, and depending on if salt affects you, I'd recommend adding possibly some minerals to that so you do maintain hydration. Again, if you're a woman and there's something with thyroid, you really need to work on thyroid, adrenal, hypothalamic, pituitary axis. So the master glands up here that send the messages for that, also consider doing something about the liver detox. All this plays together. So it's like hemorrhoids. What are hemorrhoids? Well, it's so much more than just like a hemorrhoid, right? And so the one thing that you guys really want to do is, like Jane said, is absolutely food is medicine. A nutritional supplement supplements your healthy diet.
Yeah.
Okay?
That's exactly what it is. That didn't take as long as I thought.
Okay, hydration. Stay hydrated, you guys. Really.
Yeah.
Take a drink right now. I want a drink now.
Yeah, I have my kombucha right here, but I
need a
want to drink. But so hopefully that helps. If you guys have questions, let me know. I know you went through a lot of those things fast, like
But you guys can rewind, and I didn't want to be it too long. You guys can rewind and go through what I talked about.
Yeah.
If you have questions, please post them. Jane doesn't know, she can contact me. If I don't know, I'll contact her. You know, I mean, let's work together in this community to help one another.
Yeah. So thank you. Thank
You're
you
welcome.
for when you showed up today, I'm like, we're going to talk about hemorrhoids.
Hemorrhoids, let's do it.
So there you go. Have a great day, guys. We'll see you next time.